metacarpal joint, we're going to do the dips and the pips. We're going to do the carpals. And we're going to do the TMJ. So how many moves are that? 1, 2, 3, basically 4 moves. That's all that's going to be on the test.
It's going to be rough.
Yeah. It's going to be rough, she said. Okay, this one here, the first one here, the thumb, where this first metacarpal meets with the trapezium, it's going to roll out posterior and lateral. That's what I call it. Okay, it rolls out this way. We got to roll it back that way. So you examine the good side. See how it's rolling. Go to the bad side and you say, wow, that's not rolling right because it's stuck out posterior and lateral. It's not going to go anterior and medial. You're going to roll it over like this. Contact with that interphalangeal joint basically. Grab proximal to the metacarpal phalangeal joint and you're going to thrust, lift and thrust this under just like that. Okay? Y'all know that one? The dips and pips, we're just going to basically look for them to misalign medial or lateral. There's other movements they can have. They can rotate and so on. In fact, I don't know, did I ever tell you what you do with them when they're rotated in your office? Sometimes it's not just lateral or medial. What I do in my office is I just take them like this. And this is not on the test, but I'll just stabilize proximal to the joint. And then when I'll actually traction it this way. And when I'm tractioning it, I'll twist it like this, either this way or this way, depending on what's going on with the patient. But what I'm going to have you do on these joints is just move them back and forth. If it has been fixed medially, it's not going to go laterally, right? So you're going to traction it and you're going to thrust across. So if the wedge is open over on the medial side, you're going to take it, traction it, and thrust it through, right? That's the same with all the dips and pips. For the carpals, we're just going to do a P to A glide, A to P glide. Look for a restriction in those motions. Just make sure you know where the bones are. Probably going to be like the scaphoid or the lunate or trapezoid, something like that. Okay. Motion of P to A to P. Always, again, look at the good side first. When you make your adjustment, if you're going to be adjusting, make sure you know which bone is which. Don't come up and not get the right bone. Okay, so take your time, make sure you know which ones are in here. Okay. If you don't know, ask us. If it's gone anterior, we're going to do a thumb-on-thumb contact. We're going to separate the rest of the carpals with our chiropractic index fingers while stabilizing the distal, these bones, radius and ulna, and we're going to thrust it through. Okay? If it's gone posterior, it's just the opposite of that. TMJ. What does a TMJ do? It's going to drop anterior, right? And it's going to come lateral, inferior, anterior, lateral mechanism. What we're going to do is we're going to palpate the TMJ joint while we're having the patient extend their head and open and close their mouth. While they're opening and closing their mouth, we're going to look to see which way the symphysis menti deviates. Okay, the symphysis menti will deviate to the left if the left joint is good, okay? And you'll feel that click in here. It'll go left as they're closing, it'll go left, and then it'll go right. The bad side is the side that's coming in second, and what we're trying to do is we're trying to get the bad side to catch up to the good side. By keeping the good side from setting, we're going to stabilize this, and then we're going to bring this back and over while we're putting some downward pressure on the symphysis menti, trying to catch them up so that they both come in at the same time. Remember that? And hopefully I'll remember the cervical block. I forgot them today. So, okay, do you want me to demonstrate that on a person, or do you guys want to practice? What do you want to do?
Demonstrate first.
You need a person.